Okay, so afternoon all. Thank you for joining the Celebrating Diversity SAS webinar takeover. Ben, if you're happy to, should we get started now?
Yeah, no, I think that's a good idea. So, colleagues, welcome. And as Michaela said, today, this afternoon session really is an opportunity to really, I guess, showcase our SAS doctors and have a conversation around all the fantastic things that they do, but also hear about some of their stories as well and some of their lived experiences getting to our organisation, but also within our organisation as well. And so hopefully, colleagues, you will find it a really, really interesting session that we have ahead of us. So we have got a bit of an all-star lineup, I think, I'm pleased to say. So a number of our own specialty doctors are going to be coming in and giving their own perspectives on their own journeys, and actually just tell people a little bit more about what specialty doctors are, because I think it's often quite not very well understood, the massive and vital role they play in delivering care across the whole of the NHS. And I think I think people often think about junior doctors, think about consultants, but kind of miss out this, the SAS doctors who, do get through a massive amount of work and often don't really get the credit or the recognition that they absolutely deserve. So we really wanted to kind of open up this platform just to kind of get into a bit of a conversation about that work. And also what we can all do to support each other. But the first person I wanted to turn to is one of our non-executive directors, who's a practicing GP, but has held many kind of national roles in primary care, for some introductory comments. And that's Dr. Nav Charnas. Nav, did you want to come in?
Yes, indeed. Thank you very much, Ben, and good afternoon, everyone who's out there. And I'm also really looking forward to hearing from our SAS doctors. Ben, I don't want to say too much because I think the exciting stuff is to follow. All I wanted to say was just I've had the pleasure of working with and meeting with many doctors who fall under the category of specialist, associate specialist, and specialty doctors. Probably over 30 years now, and I'm always been amazed, enthralled, and really encouraged by not only their experience, the skills, their knowledge and understanding, but also if we are celebrating diversity, the richness that their diversity brings to the way that we think about delivering care. And whilst most of my experiences have been out with this particular trust, I'm pretty sure we're going to find out today that they're absolutely committed to doing exactly the same within this particular trust as well. So I'm certainly very supportive of SAS doctors. I hope everyone else will be. So without further ado, let's introduce and welcome Dr. Imran Sharif to kind of start the proceedings. Over to you, Imran.
Thank you so much. I think my slideshow is just coming up. Thank you so much for that kind introduction. I really don't want to bore you with a PowerPoint presentation, but I just thought it was really important just to share a few slides, because I want to clarify some of the terminology around SAS doctors as an introduction to this session. Just keep it up.
Imran.
Yeah.
Can you introduce yourself?
Oh, sorry. Yeah, of course. So yes, my name's Imran Sharif. I'm a SAS anaesthetist. I am working at Queen Elizabeth Hospital. I am currently the SAS advocate. I was appointed to this role in March of this year. And I'm also the LNC chair, which is the local negotiating committee, which represents doctors of all grades from a trade union perspective and from a local terms and conditions perspective. I've been in the trust for probably since 2010, I think. Sometimes I have to remember that. Yeah, I really love working in the trust. So I'm very conscious that a lot of people won't know who SAS doctors are or won't really be familiar with the terms. So I thought I'd just talk you through some of our terminology. And you'll be conscious that I might have sent out some communications about SAS Week, and I'll explain what SAS Week is and really why it matters. So SAS doctors, or a group of doctors with a real huge breadth of experience. They're not in formal postgraduate training, but neither are they on the specialist register of consultants or GPs. And I guess the first thing that everybody wants to know is, what does SAS stand for? Well, SAS, it can be confusing because this has changed over time. So currently SAS stands for specialist, associate specialist, and specialty doctors. So the associate specialist grade is a grade that closed 15 years ago, but we do still have a number of associate specialists who work with us in the trust, and WAFA, who's our next speaker, is one of them. Specialists is the new higher SAS grade that was introduced a couple of years ago with contract reform, and we don't quite yet have very many specialists appointed in this trust, and hopefully that will change. So most SAS doctors in the trust will be specialty doctors, and that's the same across the UK. The majority of us will be on that contract, but we're all part of the same SAS family. Just to be clear, SAS doctors or their equivalents have always existed since the inception of the NHS. As we've discussed, they have a variety of titles, but really what has united them since the 1960s is that they have national terms and conditions under SAS contracts. And there's another important group that I really must mention. That's the locally employed doctors. So they are also not in formal postgraduate training. They're also not on the consultant or GP specialist registers, but they also don't have SAS contracts. So these doctors are employed by trusts, often on short-term contracts, and they can be known as by a variety of different names that you may have heard of. So they might be trust registrar, trust SHO, senior clinical fellow is a very common one. Foundation year 3 is another type of locally employed doctor. And so these doctors are very commonly international medical graduates, and they can be early in their careers, but they're not always early in their careers. And our UK qualified locally employed doctors often report a range of negative experiences in the wider NHS, and they're very much more likely to leave UK practice. And so it's really important to think about this group as well. So the next obvious question is, how many SAS doctors are there in the NHS? And that's a question that I can't really answer, and neither can the GMC, because no one really knows. But from this workforce report, it's probably data that's a couple of years old, the GMC were telling us that there was about 320,000 doctors in the UK. There was about 90,000 consultants. There's about 70,000 GPs, and about 70,000 doctors in postgraduate training. And therefore, by a process of exclusion, the rest must be SAS and locally employed doctors. And in fact, although the medical workforce is growing slowly, the increase in numbers of the SAS and locally employed cohort is astronomical, is rising dramatically. And most of the increase comes from doctors coming from abroad who have international medical qualifications. The next question is, well, how many SAS do we have in the trust? And again, it's not a simple answer. We get our data from ESR, and the data from ESR really isn't perfect. According to the most recent spreadsheet that I saw, we have about 70 SAS doctors in the trust and around 200 to 300 locally employed doctors at a guess. There's a few departments where we have a lot of SAS doctors, for example, in anaesthetics, or in ENT, or in general surgery. But the vast majority of SAS doctors working in the trust really work in departments where they're very much in the minority in terms of the medical staffing. And one of my jobs as the SAS advocate is to not only give these colleagues a voice, but to reach out and to give us a sense of community and peer support across the trust. So why do we have a National SAS Week? So many organisations, as Ben alluded to, have recognised that SAS doctors are a little bit under-recognised part of the medical workforce and feel undervalued. And so last year in 2022, a SAS week was created. And I have to say this year it's really taken off. And it's mostly taken off for a number of reasons, locally as opposed to nationally. There has been a raft of events, and the positivity on social media has, which you may have come across, is really, it's hard to miss. It's hard to miss. So I won't talk about EDI issues because Eric is going to come on to that, but I will mention some of the national issues. So SAS doctors definitely do feel that they're starved of some professional development, and they struggle to get progression, for example, to the specialist contract. Many of them might already be kind of working at the level of a specialist, but it isn't quite recognised. And many SAS feel that they're not offered the same opportunities in terms of research, medical education, leadership opportunities as some of our other colleagues. And I know this webinar is specifically about SAS doctors, but I think there's these type of frustrations are not unique to SAS doctors, and they're applicable across the organisation. I think there's really no one in the trust that should be denied the opportunity to develop themselves, and everybody should be encouraged to progress in some form or another. Nobody wants to stagnate in their career. However, certainly internally and externally, there are plenty of examples where there are many exceptions. SAS doctors are smashing glass ceilings left, right and centre. These are some of my colleagues and some of my friends from across the UK. For example, on the left, there's Laura. Laura is a obstetrician, and she's currently the Vice President of the Royal College of Obstetrics and Gynecology. Next is Lucy. Lucy is a SAS anaesthetist in Swindon, and she's a clinical director and has been for many years. The next is Jamie Reid. Jamie Reid is a SAS geriatrician who works in Cardiff, and he has been he is the current Dean of Cardiff Medical School. And the last one there is Rob Fleming, who is very active on social media and has also recently been appointed as a board member of the Association of Anaesthetists. So we have all sorts of hidden and not so hidden talent in our SAS community, both outside this organisation and within this organisation. And that's why we're opening our nomination for our Trust SAS Awards. Now, this isn't something to take over or separate, to replace the Trust Awards, which I would encourage everybody to nominate people to. But this is just a separate thing, just for SAS doctors and locally employed doctors who've been in the trust for 2 years or more, just to recognise them, because sometimes they need a little bit of special recognition. So please do consider nominating a colleague who you might be working with in your department. Thank you so much for listening. And I'm now going to hand over to our SAS tutor. That is Wafa El-Touhani, and she is a associate specialist, as I mentioned, in sexual health. So I'll pass on to Wafa.
Thank you, Imran. Thank you for the introduction. I'm Dr. Wafa El-Tantawi, and I'm Associate Specialist in Sexual and Reproductive Health. I have been in the trust for 20 years. Why I have been in the trust for 20 years, despite the fact I live in the other side of the Thames, and it's a long journey commuting every day, is because I'm happy in where I work, and I'm really feel validated and feel appreciated. I am also, you see, because today is day 3 of the SAS week, and the theme is SAS in extended rules and SAS development. I'm proud to also say that I am the lead for the psychosexual clinic in Lewisham Trust, and I'm also educational and clinical supervisor, as well as I am LNC SAS representative and a trust appraiser. So I have really occupied some of the leadership roles. Not only me, but we have many examples in our department. For example, one of them is Dr. Samia Adel. She is with us today, and she is a training program director for the DFSRH, the Diploma of the Faculty of Sexual and Reproductive Health. We have also other doctors who really holding a very leadership roles. My role as a SAS tutor is to promote professional development of SAS doctors and to enhance contribution of SAS doctors in education and training in relevant specialties. I organize courses and programs to improve and support the development needs for SAS doctors. Over the past years, we really delivered a lot of very valuable courses in the trust, like leadership courses, resilience course skills, training the trainers, and bullying and harassment, and educational and clinical supervision courses. And also we develop like courses for running difficult conversation, and also we have a very interesting course about using the language in medicine. Also, we done some other courses. But one of the things, the most important thing we introduced last year was the coaching and mentoring training, which was for 3 years. And really it was valuable training where we managed by the end of it to get like 5 coaches and mentors. And the idea of this is to develop a platform for SAS doctors to have support, as Amran said, in their career development. And we are hoping in the future that every SAS doctor will have been allocated a mentor or a coach after running this program, which we are going to run this year again, to develop more coaches and mentors, so each SAS doctor will have the support they need in the trust. We also run a SAS forum, which runs every 3 months. We used to do it face-to-face before COVID, but now we run it online. But we are hoping to get it again run face-to-face, hopefully one time in Lewisham Hospital, one time in Queen Elizabeth Hospital. And the idea of this forum is to get SAS doctors together and try to listen to them more and find what issues they go through, what their needs are, and we have a frank discussion about many things. We also run a WhatsApp group which has 80 doctors. Again, I echo with Imran that we include locally employed doctors, because really SAS doctors and locally employed doctors together, they can form the majority of the workforce in our trust. I would say more than third, maybe Mira can correct me if I'm wrong. And really we form the bulk of the workforce in Lewisham and Greenwich Trust. So they are part of our tribe as well. And we used to call SAS doctors as a forgotten tribe, but I feel we are getting out now. And I feel that the trust and trust executive are really there, and they listen to us and support us. And thank you for that. So yeah, we are trying hard. So the WhatsApp group is a very active platform for all SAS doctors and locally employed doctors. Again, bring issues and webinars, and Imran is really doing a good job there and informing us about a lot of things and have interesting discussion there. We also run the SAS Development Day. We have been running that since before COVID, but it has stopped during COVID. And we ran one in October, in the SAS Week, October last year. And it was really a very successful one. And it was well attended. It was online because we felt face-to-face people were not ready yet. And again, online, it helps people to attend even more. And we really talked about many subjects. We like how SAS can be successful educated, and how SAS can find alternative career pathway and opportunities for SAS doctors in different specialties in simulation. There was a lot, and they ended up by the SAS award, where Ben kindly presented the SAS award to our SAS doctors, and really the nomination was, we received a high number of nomination, which was all a really valuable nomination, and we were touched by the amount of excellence and the work and the experience SAS doctors have, and how they go beyond their, beyond their ability even to help and do good work in the trust. So this, and again, we end the SAS Development Day every time by an open forum with the trust non-executive, with the trust executive and directors to ask questions and raise any issues of the SAS doctors. And it was really very interesting discussion last year. We listened to SAS doctors, and we try hard to get them engaged. And I hope this platform will again reach all SAS doctors. I know that there are limitations for them to get engaged because, as Imran said, they are really not acknowledged for their development needs, and sometimes they are not released to do courses and enhance their career development. And some of them don't have job plans, some of them don't have SPA. So there are still a long way to go, but we try to listen, and really I'm happy that the trust listened to us and get engaged now more than before. We also receive a fund every year. That's why we run all these courses from the HE, Health Education England, where we use this fund to widen our professional development program for all SAS specialties. And on top of that, we add extra fund to the study leave, the trust study leave, to help people to fulfill their specialties in a certain way. I mean, everyone has certain skills in different specialties to fulfill. So we help them by giving them extra fund to do that, particularly people, they are striving to complete CSER. And this year we will support people more because we have extra fund from the 2021 contract. So I will end up my talk with the quote that all extended roles in leadership and management should be open to all substantive medical staff, e.g. consultant, and appropriately experienced as doctors. Thank you very much for listening.
Yeah, thank you. Oh, thank you, Wafa. Imran, did you want to come in?
Oh, okay, I was just going to ask if Wafa was going to introduce the next speaker. That was amazing, Wafa. Thank you so much for updating us. Would you like me to introduce the next speaker?
Yeah, introduce Imran. Sorry, I haven't got the program in front of me. My apologies.
Okay, so our next speaker is one of my close colleagues from my own department. His name is Dr. Eric Fawcett. He's a specialty doctor in anesthesia, and he's going to talk to us a little bit about why SAS doctors, the topic of SAS doctors relates to equality, diversity and inclusion.
Hello everyone. So my name's Eric Fawcett. I've been an anaesthetist for over 15 years. I was the SAS chair for the Obstetric Anaesthetic Association. And I also embody intersectionality in EDI. I fractured my spine, so I'm physically disabled. I have ADD, so I'm neurodiverse, and I'm transgender. So this week is National SAS Week, but as a trust, we're also here to celebrate diversity. So in the spirit of diversity and intersectionality, I would like to talk about the multiple crossovers that exist within this diverse group and the measured impacts reported by the GMC, the BMA and NHS England. Next slide, please. So going back to Imran's SAS and locally into Imran's comments, SAS and locally employed doctors have historically been sampled as one metric. And many locally employed doctors should be on SAS contracts. So together they make up over 1/5 of the medical workforce, and this number is rising. Over half of this group who gained a license to practice by the GMC had left the workforce by 2021. And this is postulated to be a combination of international graduates taking up fixed-term positions in the NHS and the historical issues of poor career prospects and working conditions for SAS doctors. GMC surveys and reports have found that SAS doctors overall had worse appraisal outcomes, higher rates of deferred revalidation, and higher rates of bullying and harassment. Next slide, please. So looking at SAS doctors and racial inequality. So the bar chart from the Medical Workforce Race Equality Standard Report, or MRES, shows that the average proportion of Black and minority ethnicities within the UK, BME, versus white doctors. So 41% of all doctors in the UK are BME, and this is overrepresented within the SAS group, comprising about 47%. They are strongly underrepresented within the clinical director and medical director roles, and this trend extends to academia. Next slide, please. Next slide, please. Thank you very much. So from the GMC workforce reports, international medical graduates are increasing in number within the workforce. And this graph shows that the highest numerical increase lies within the SAS and locally employed group. Next slide, please. So SAS doctors have the highest representation of BME doctors and an increasing number of international medical graduates. So from the MRes, we can see that for SAS and locally employed doctors, ironically grouped here as other, BME doctors have the highest proportion of harassment, bullying and abuse at just over 30%. Next slide, please. So moving on to disability. So over a third of disabled SAS doctors have been bullied or harassed due to their disability. Disabled BME doctors feel more uncomfortable disclosing their status and are less likely to have reasonable adjustments put in place. Next slide, please. Ironically, the SAS role can be more suitable for disabled doctors, and it's one of the many reasons doctors choose this career path. Lack of rotational training means that a single permanent workplace exists where adjustments, which are often very difficult and time consuming to institute, as anyone who's part of the Dawn network will be aware of, can be put in place. Commuting can be optimised and stable supported peer networks can be developed. Flexible working has been reported as an issue in training programmes, but is much easier to institute within a SAS contract. Progression through the training programme can also be difficult for those, for example, needing sick leave, and neurodiverse trainees who have often been denied reasonable adjustments despite qualifying for them, have been removed from training programmes due to exam failure. I think there's somebody currently taking up litigation over to HEE over something very similar. So next slide, please. So to conclude, SAS and locally employed doctors have a higher representation of BME doctors than any other grade. They are the most diverse group. SAS doctors are at higher risk of bullying and harassment overall. Over 30% of BME SAS and locally employed doctors have received bullying and harassment due to their race. And over a third of disabled SAS doctors have received bullying and harassment due to their disability. And SAS doctors of all backgrounds suffer institutional inequality. Thank you so much. So I'll take questions at the end, but my next speaker is the incredibly eminent and inspirational Iman Toyma. She's a post-CCT specialty doctor in obstetrics and gynecology, the chair of the Royal College of Obstetric and Gynecology SAS Local Employed Doctor Committee and the LNC SAS rep. Thank you very much, Iman.
Thank you very much, Eric, for this introduction. And it's very difficult to follow on from what my colleague had already said. Amazing talks by Wafa, Imran, and Eric. Thank you so much. I would like to start by thanking the conference team for allowing us this platform today to introduce ourselves and increase awareness about what SAS doctors are. I had the honor of being one of the members included in the committee who was tasked with preparing the program for the first EDI Trust Conference. And I can't tell you, as soon as I mentioned that this is going to coincide with the SAS week celebrations, there was immediate response. There was immediate agreement that this should be included as part of the program, and I'm really very grateful for this. So this is the first time that we are holding these celebrations. So thank you very much to the conference team. Thank you for the trust, for allowing us more space. I've been working in the trust for the last 6 years, going into 7 years now. And I'm one of the people who have seen a massive change because I've joined at the end or near the end of a very, very difficult period for the trust. And I have seen over the last few years, amazing amount of work, reaching out to everybody, including SAS doctors, including disabled members of staff. The trust board, led by Ben and Mira and other members, have done a great deal of work, recognizing what they have missed over the years and how to tackle that and how to make it better for everyone working in the trust. I've certainly felt that myself. At the moment, there's a bit more attached to my title, which is the Secretary for the Disability Awareness Network. And this is one of the staff networks that was set up recently in the last few years. And I can't tell you the difference this network has made to myself as being myself a registered disabled doctor and to other disabled members of the team. I've also just been appointed as the differential attainment champion for the trust by Health Education England, and it is a pleasure and an honor that this is the first time a SAS doctor has been appointed to this post. I'm looking forward to engaging with my colleagues and trying to address some of the difficulties Eric has just mentioned in his slides and trying to correct it and trying to make it better. I'm pleased to say that actually the college has just used my long story worth of 30 years of experience as part of the celebrations for the SAS week. And if you can see my screen at the moment, you can see that my story is online at the RCOG website, not only as a chair for the SAS committee and the representative for the college at the Academy of the Medical Royal Colleges, but also as an example for SAS doctors in extended roles and how we can benefit from every opportunity and how we can progress further. And we can reach as far as we can, believe me. As you can see, I've chosen my background today. It took me a little bit of thought to choose my background as to what I would like to be the message to take home today. And I chose the bridge because knowing that the trust has started a massive amount of work to reach out for all types of employees and all types of doctors and everybody working in the trust, I would like that to extend more. I would like us to build more bridges. I would like us to reach further, reach out further. Hopefully we can adopt the SAS charter, which has been out now for nearly 10 years. And I would like to see more of this being implemented in the trust and taken over by individual departments as well, not the board only, but by each individual department. And that's it from me. Thank you.
Thank you, Iman. Our next speaker is Dr. Sonali Guha, who is also a specialty doctor in obstetrics and gynecology, and she's going to tell us a little bit about her lived experience as a SAS in the trust.
Hi everyone, thanks for giving me opportunity and thanks to the organizers. I'm Sonali Guha, one of the SAS doctor in obstetrics and gynecology. So I have been in the trust for almost 17 years. So you can see how much I love to work the trust. Unfortunately, I don't have a long title behind after my name or anything. So I'm a very simple, just a doctor. So I have a mixed experience from this trust. Obviously, it shows if I am 17 years that I must be very happy, but all has not always been so happy journey. So first let me explain to you. So good things about what I experienced. So I have gained a vast experience from the trust, working in the trust in different categories. I came as a junior registrar, then a senior registrar, then and surprisingly, I got CCT, and which was initiated by late Dr. Jane Barth. Some of you know me. She was my mentor, my boss and everything to me. And she actually brought the copies of paper to give me that you can progress and do a Caesar. So I'll always remain grateful for that, and that is my greatest achievement. So moreover, I get a respect as a experienced doctor, not as a SAS doctor. So I have very good rapport with staff members. They consider me as a family, and whenever they have a problem, mostly health issues, they come to me for some reason rather than going to directly to a consultant. So I have received Employee of the Month in the past for my contribution in the rota management when it was a takeover. We used to have three parts of the trust, like not LGT at that time, previously with managing 3 hospitals. So so I have gone through a very good journey, but obviously there are some mixed issues as well. So what I echo some of my colleagues that all has not been good for the SAS doctors. Some have been lucky to have only good experience, but I don't think so. Everybody doesn't want to bring up the other things because we are celebrating, but I thought this is a platform to express my feelings. So and I promise I wouldn't sound very bitter. So my first point is that we all SAS doctors, especially post CCT doctors, work as a capacity of a consultant, but obviously you all know that our payment is not as lucrative, and we get less SPS sessions to do other work, extended role work. So, and I don't know if there is a solution to this. So my main concern is that I am mostly concerned as a experienced registrar rather than an experienced independent practitioner. And so what happens is when there is a something need to cover in the registrar rota, I am called. When there is something to cover in the consultant rota, rather than a consultant covering that, I am called as well. So I am truly then a middle grade doctor, but I think a lot of people object to the term middle grade. So trust has still a long way to go to expect, at least in my experience, to us as an independent practitioner, and we need more recognition. So moreover, I don't know if there is any consultant here. When there is a consultant, we have a dedicated consultant meeting every Friday. We are never called in that meeting, and if we are there by accident, we are politely asked to leave. So that is, again, we are expected to work as a consultant, but not really stay there. Even the consultant, when they do social, they don't call us. We don't even have a room. We share the room with the registrars. So I do a lot of ERAS sessions. Session, which is prioritizing the when the GPs send the letter to prioritize the clinics, and I don't have a room. Believe me, I have to beg for a go search for half an hour for a room to do my session when I could have actually prioritized probably 30 patients. So we don't have and we don't know who to ask about a room for SAS doctors. Lewisham has one, I know that, but in Queen Elizabeth, we don't have a separate room. So, and I am coming to the end of my session. So there was some improvement in the SAS. Last year, there was a lot of attendances from the top brasses in the trust. I think Ben was there, Maria was there, and other people were there. But and I really expected that, and there was an awareness created, and I really expected to see that awareness being created in the trust communication, which comes out every Wednesday and Friday. And I keep looking few weeks, but there was none. And that is something I think people can take over. I don't know who sends the trust communication, who is in charge of it, but they're not aware of us. Maybe this SAS Doctor Week is a big issue but sometimes we need to know that we do exist. That I think that is all. So I have to say mixed experience, but I'm still happy and come to work every day with a happy face and try to be as helpful as possible and do as much as and I'm hoping to retire happily from this trust. So thank you very much again.
Thank you so much, Sonali. I just want to pick you up on one thing. You're not just a doctor, and I think from what you've said, we can all tell that you're not just a doctor. You're not just anything. So our next amazing speaker is Dr. Tatiana Bokova. She is one of my colleagues. She's a specialty doctor in intensive care medicine, and she's also going to tell us about some of her lived experience in the trust. Tatiana.
Thank you so much, Imran, for introducing me, and good afternoon to everyone. So I'm Tatiana, one of the doctors from intensive care unit, and I've been in the trust since 2014. And in 2016, I was appointed as a SAS doctor, but one of our ITU consultant, Dr. Harding, who's recently retired. I like the idea that we actually have a meeting today and we're introducing SAS doctors as a group of people, because sort of since 2016, so I've been answering multiple questions from my colleague. I work like every day. So what I'm doing here and why I haven't moved and what I'm going to do next and who I am. Some people were calling me a fellow, which is a good word, I think. So, but it's not exactly what I am probably. And some people were calling me like a registrar. So, which is also not exactly what is my title is. And when I try to explain, so there is another group of doctors that people got really confused and puzzled. So I think it's good thing to get more people to know about us and introduce our big group to wider audience. So, and I also have a very long title attached to my name. So to start with, I'm international medical graduate. So, and English was not my first language when I came to this country. I also former ophthalmologist, because I completed my ophthalmology training, and then I moved to the country. I decided to go for a challenge, and I decided to become intensivist. And then I came to intensive care, which is predominantly sort of historically been like a male area of medicine. And I also a mom of 3 kids, which I really enjoy my sort of diversity in these sort of things. So I actually enjoy working with the trust, and I really enjoy working in intensive care, Queen Elizabeth Hospital, because they basically gave me opportunity to thrive and to sort of continue this intensive care job, which is very intense and stressful, as you can imagine, and also feel myself satisfied with my other life, which is like mom of 3 kids. So they gave me opportunity to have a more flexible rota, so to have more good work-life balance, and I quite enjoy that from this perspective. So I also have progression of my skills and clinical skills and other skills in my own pace. So, and this is very good and fulfilling role as a SAS doctors. And I've been involved in many training for junior doctors within our department. And I think as a group of specialty doctors, we need to stay positive and we need to stay active. So I consider myself as an active person. I try to dig into the different roles throughout my career, either research or clinical skills, or improving my just master my like intensive care skills. So, and I'm actively usually asking for opportunities. So my satisfaction was very good. My only criticism is that sort of I noticed that because people probably not familiar what to do with us as a group of SAS doctors. They really don't give us enough educational roles. They don't promote us enough as a leadership, and they don't give us a good progression because obviously we don't have, as a trainees, we don't have a program which we need to follow. Even as an active person, I try to push for that. Sometimes I don't have a appropriate response for that. That's what I want to bring. So because obviously, so at some point you overgrow your role, and I'm still happy to help department and help trust, and I really enjoy any type of job I'm giving, and I try to do my best to do that. So, but I think that as a person who's been in a trust for many years, I think so trust needs to consider us and probably think about a program to develop permanent staff as educational leads and as a clinician leads, so that we can progress further. So, and I think that otherwise it's very fulfilling role, especially for those like me who has some family responsibilities and who still wants to balance with their work and family life. And I'm very grateful that I'm here and I'm involved in many things within our trust. And I'm very grateful that now, so I can see a positive thing that we're moving forward, and we heard from our voices are heard, and I'm very grateful for that. That's what I wanted to say. Thank you so much for listening.
Well, thank you very much, colleagues, for sharing your reflections and your stories. And I really think you've kind of really brought to life a number of issues that we need to reflect more on. Actually, I was going to ask Nav if you wanted to come in just with a couple of thoughts of your own before we open the floor up to questions.
Yeah, thank you, Ben. I mean, once again, it's an absolute privilege for me to hear, the amazing stories of that our colleagues have shared here, and I think they probably only just scratched the surface of what A, they do and the contribution they make, and B, also, I think have been very polite and measured in stating some of the challenges that they have faced and are continuing to face going forward. And I think we really do need to listen to some of the things that we need to do. Ben, I guess one of the things that I've been saying to lots of colleagues in other areas is the notion of creating a medical community where actually we look at our medical community of colleagues as a single group of people with diverse skills and abilities and attributes, and really not try and discriminate as to who should get which leadership or quick career progression post. So I think that's certainly something that I would like us to continue to think through across the trust. And I guess the only other thing I would say, Ben, is that I think Imran used referred to the old aphorism of SAS doctors being a lost tribe, and I think what we've heard today is that there are tribes that have been found, but we need to do more to actually make them feel at home and that they belong. So I kind of feel that that's probably some of the things that I'm reflecting on, having heard these stories. And a big thank you to everybody for the amazing contributions and presentations that you've given today. Thank you, Ben.
Yeah, well, thank you, Nav. And I mean, I have to say, really insightful words there. And I think this idea of the medical community, I think is really interesting to explore. And that idea of how do we give everyone the opportunity to move into some of these leadership roles, I think is a really good challenge, actually, and one that we need to take on and really actively consider, because I guess just listening to some of our colleagues, the experience that people bring to the table and the expertise that people bring around their particular specialties, and it's just sometimes it feels almost like happen chance that you haven't had same opportunity to get on that consultant kind of train, as it were, and how do we really kind of think about this in a different way? So I'm yeah, absolutely keen to take that challenge on. I was wondering, Mira, did you want to say just a couple of words? Because I know you've been giving this quite a lot of thought alongside Vanessa.
Yeah, so in fact, Vanessa's here with me. I'm not in a very quiet space. That's the reason I didn't put my hand up earlier. Just bring her in as well. I mean, listening. I should just say, firstly, just listening to the stories was very, very humbling. I think I just recognize how much courage it takes to actually share experiences. I mean, although all of you have tried to give a hint of positivity when you've shared the stories, I think the reality of the challenges that many of you have experienced really comes through, and I think that's quite a sobering reflection that all of us as execs and senior leaders need to reflect, and that's true of every single story. I think just the I do feel as an organization we have come very far, but just those stats that Eric put on the screen, I mean, this is data that we do recognize, that SAS doctors, particularly many of them internationally trained, that they come in and their experience of the NHS is very, very different to those of others. And I think probably what comes home to me is not so much specifically about SAS doctors, but that any group of people, when they feel othered, and in this case, this is SAS doctors feeling that they're other than, they're not consultants, they're not junior doctors in training, but they're just that's other. And the experience for any group that feels othered is always very, very suboptimal. And really, it is our role as senior leaders, Vanessa, myself, Ben, and all the other exec and senior leaders in the organization to really make the experience better. And I think the challenge is quite clearly set out by all of you today. And I'm very grateful for the fact that you had the courage to speak so openly and honestly. I feel quite privileged to be able to hear that.
Yeah. Thank you, Mira. I mean, Vanessa, you're obviously you're what, 3 months in, 4 months into your time here. 4 months, yeah, as the I guess not so new Chief Medical Officer amongst us. Did you want to just give some of your reflections, particularly, I guess, that challenge around creating a kind of more of a medical community, and thinking about where we draw our leaders from?
Yeah, thank you. And I'm sorry to join the meeting that I'd already arranged to chair an away day today, so I've missed some of the discussion, but I really look forward to catching up afterwards. I suppose the two areas I think we really must focus on quite urgently, and Imran and myself and others have spoken about this, is one are the development and harnessing the real strengths and diversity from our staff and associate specialist workforce. So we have, if you look at our apprenticeship levy, if you look at our training and opportunities, actually, how accessible is that? How much are we making people aware of that? And how are we addressing, the different needs of our different workforce? And staff and associate specialists will have some different developmental and professional needs than others. So that's something I'm really moving forward on. I've been working with Mira and the apprenticeship team to expand our development opportunities for all our medical workforce. And the second thing I feel absolutely passionate about is the recognition of those within our staff and associate specialist workforce who are incredibly skilled, who have got a huge amount of experience that they deliver for our patients and our teams. And actually, how are we utilising the specialist role? How are we identifying the opportunity for those individuals? And I'm really keen to work with Mira and all of you to make that a reality for our workforce. Yeah, and can I just add, Ben, I'm sorry to just take the opportunity, the fact that my audio is on, is that I think there was a slide that Imran you shared earlier on about locally employed doctors, and I think you will know that probably about 3-4 months ago when we first had this conversation and seen the data, I was quite struck by how many locally employed doctors we have, and that's not really a position that's tenable. It's not fair to these individuals. If these are roles that we need to employ those roles substantively, and I think it's a challenge that we have taken on to make sure that we check those contracts. We check to see whether those are truly fixed term or whether or not they need to be substantively employed, to give those individuals who are giving so much of their time and their careers to LGT the sort of the assurance that this organization values the work that they do and will give them a career that's stable and sustainable.
Yeah, I think that's a really, really good point, Mira, around rolling fixed term contracts are absolutely not what we should be aspiring to. And I know how much anxiety they cause in people's, in people's lives, really, isn't it? That kind of sense of uncertainty and that sense that you're not really in control of your career in the same way, and you don't have that sense of certainty. So I think that's a commitment we can definitely give, to really challenge ourselves around every single one of those, and ask ourselves whether that is the best way to proceed for the organisation and also for the individuals, because normally those things can actually line up quite well together. I'm going to bring Imran in and then go to Wafa, and then I'm sorry, colleagues, this time has absolutely flown by this afternoon. I've just seen we've got 4 minutes left, so I'll go to Imran, then to Wafa.
Yeah, no, thank you so much. I wanted to just reiterate that I think a lot of the issues that we've raised from the SAS doctor community are issues that affect the whole workforce. And I'm doing some separate work with another organisation external to the trust, and we have a number of asks across the country, and I think they're reasonable asks, and they involve all of the stuff that you've been talking about, or stuff that other trusts are doing. For example, identifying long-term locally employed doctors who are really hidden SAS doctors and giving them the right contract for their work, which will improve retention, and it's a benefit to the trust. Identifying doctors who are eligible for the specialist role and can progress, and giving leadership opportunities to every doctor, opening them up to every doctor. So these are all common themes that we've been talking about nationally in terms of SAS Week, and I'm glad to hear that they've already been raised by you guys. Yeah, sorry, I'll keep quiet now. Thank you.
Yeah, no, thanks, Imran. Wafa?
Hi, thank you. Yeah, I want to say thank you, Mira, thank you, Vanessa, thank you, Ben, for recognizing that there are really a big chunk of workforce who needs to be having the right contract and really move to a different, whatever, SAS grade or whatever, because we have been talking about that for 2 years now, I think, or more in the LNC, and really we need to get like a unified kind of workforce for this group of people. Thank you for acknowledging that. Thank you.
Yeah, no, thank you. And as I said, that's absolutely a commitment. Well, one commitment we can make today is having a look at all of those contracts and just seeing whether that's right, because I can't imagine it is in many cases. But colleagues, as I said, we are kind of pretty much at the end of our time, but it's been really an absolute pleasure to listen to our colleagues, and I know in the EDI we have got some external speakers, but I have to say I love listening to our own colleagues' experiences as much as I do listening to colleagues from outside. And as we kind of reflected, it's probably about 1 in 4 doctors across the country are, fall into the SAS category. So, this is a really significant workforce. We've talked about there being probably about 300 of our medical colleagues in LGT, again, who would kind of fit this kind of bracket, as it were. And so clearly there is, more that we need to do to make sure we are properly listening and then acting on the back of it. But I think it's been really fantastic, some of the challenges that's come through, the openness, but also the appreciation that I've seen from so many other people on this call towards all the work that has been taking place. So thank you very much, colleagues, for your time. I think it's been a brilliant session. Thank you to our speakers. Thank you to Nav for your wise words, as always, and look forward to making some progress on this. Thanks a lot, everyone, and have a fantastic rest of the day.
Thank you.